Good afternoon, everyone. Welcome to another Ovadia Heart Health telemedicine live stream. Today, I have the privilege of having nurse practitioner Lisa Simmons back with us. She's going to talk to us a little bit today about the big question on a lot of people's mind, and that's statins and are they necessary? Why someone would want to take them, and what are some of the reasons why one wouldn't take them, and some of the things that you could do instead of taking statins. Um, Before we get started, I got to put our medical disclaimer up and just let everyone know that the things we talk about today are for information purposes only and not substitutes for professional advice or treatment by a licensed healthcare professional, even though nurse practitioner Lisa Simmons is a licensed healthcare professional. The information she's providing today is for educational and informational purposes only. And if you'd like to meet with someone at Ovadia Heart Health and talk about how you can work directly with one of our medical professionals and get involved with our whole Ovadia Heart Health telemedicine team, please reach out to team@ifixhearts.com or visit us at ifixhearts.com/talk. And we can set up an appointment for you to talk with our metabolic health coordinator, and we can get the ball rolling on that. With that out of the way, I am really interested in hearing what you have to say, Lisa, about statins in particular, and some of the things that someone who's concerned about their heart health might want to do to optimize their metabolic health, their heart health, and their overall quality of life. Can you talk a little bit about some of the biggest misconceptions that you deal with when it comes to statins?
Well, in general, Chris, when we're talking about statins, right, they're just a medication. They have a purpose, right? So the biggest thing that they do is lower the total cholesterol and the LDL cholesterol. But what are they really doing, and how are they doing that is the important thing, right? So working in the liver to prevent, more cholesterol from being made. But then again, you have to think, why do we make cholesterol in the first place? And what is its true role in the body, and do we want to inhibit that production? So I think, if this stems back to the 1950s on really what cholesterol is, it's been really ostracized as the bad guy in the terms of, overall heart health in general, and with plaque buildup within the arteries. But you really have to get down to what the root cause of those problems are, which we know really the basis to most chronic diseases is inflammation and insulin resistance. So,
One second. Why, like it seems to me that in mainstream medicine, basically, patient finds out their cholesterol is high, and then almost reflexively comes a prescription for a statin. How come you just mentioned inflammation? How come the discussion about inflammation and maybe ways that you can reduce inflammation without a statin isn't something that's more commonly discussed or prioritized?
well, in mainstream medicine, we're taught to diagnose and treat. So you're given a diagnosis, and then you're given a pill to fix it. But when you think about inflammation or insulin resistance, those are kind of precursors, right, to other things. So it's more of a preventative measure. And unfortunately, in modern medicine, or our mainstream medicine now, everything is more insurance based. So unless you have a diagnosis and a treatment for what's going on, then it's really hard to bill for that, because insurance doesn't notice that. And I think that that's probably the biggest problem. But also too, it's not necessarily about the number. Within our practice, we really look at the quality of the cholesterol, because that tells us exactly what's going on. Deep, big and fluffy, small, dense, right? So really looking at the quality of the cholesterol, which is not done on a regular basis. You get a standard lipid panel. And that's really, if you go to your primary care doctor or your cardiologist, that's the one that's going to be done. There's not the deeper dive into the particle sizing, which really tells us a little bit more about the quality of your cholesterol, which is very, very important.
Now I know that that you do consultations where you do a lab consult with the patient, and I think you spend a full hour going over all the nitty-gritty details and explaining what the numbers mean and what a patient might be able to do about some of the numbers. First of all, tell me about the depth of the labs themselves. Like I know that the typical number of metrics or markers that are evaluated in a Ovadia Heart Health lab panel is significantly more than what you'd get at your regular run-of-the-mill doctor's appointment.
Definitely. We hear that a lot because we're like, I don't think I had any blood left by the time I left the lab, right? But again, it is very comprehensive. We want it to be comprehensive because we want to know what's going on with you on a deeper dive on what's going on the inside. I think, in mainstream medicine, even for myself, you go to the doctor and they look at you and then they go, okay, you just need to eat less and exercise more. That's going to fix all of life's problems, right? At least that's how it was as I was growing up. But then two, you only went to the doctor when something was wrong. And, then you would get this diagnosis and then you went for another thing and you get another diagnosis. When I'm doing a deep dive into labs, I want you to understand what we're looking at, why we do these labs. And really, if they're not optimal, right, there's good and then there's optimal. I want you to understand how you can make those better. So after you've seen me, which is a deep dive, you can ask any questions that you want to ask, which is super important, right? And really getting the answer that's going to be the right answer for what's going to go on with you. Because we look at every single patient as an individual and finding out what's going to be best for them to optimize their labs, make things better. If they have some inflammation, how are we going to work on that? What's the cause of the inflammation? And then also to insulin resistance. And even people that come to us who have been doing this for a while, they want to be reassured that what they're doing is the right thing. So now they're eating protein and they stopped taking their statin and their cholesterol went up. But is it a bad thing? That's where the particle sizing comes in. It's really an important tool to really see exactly what's going on, and then also addressing the inflammation and insulin resistance. But going through every single lab with a fine-tooth comb so that, you can ask the questions that need to be asked, but also to have answers and actually learn other things that you probably didn't know before you came and seen.
So tell us a little bit about inflammation and how do you know if you have inflammation and what kind of things can a person do to reduce inflammation?
So a couple of the main lab markers that we check for inflammation is going to be C-reactive protein, or HS, high sensitivity C-reactive protein. We check that just to see if you have overall inflammation. There can be multiple different causes, right? I think the biggest driver that I find when I see patients is, I think, stress. People have a lot of stress and it really shows in the inflammation markers. We also do check a homocysteine. This is not a normal test that your doctor will do. It lets you kind of know that does cause inflammation within the vessels, which can be doing damage. Again, cholesterol is the healer. It wants to go and fix the damage, but we need to figure out why the damage is happening in the first place. So again, looking at it like that. So looking at inflammation, but I think out of all the markers, I always talk about the 4 pillars of health, which is nutrition, exercise, stress, and sleep. I think stress and sleep play such a huge role and they really get overlooked a lot. People think, oh, it's okay. I've always heard I can sleep when I'm dead. Well, we don't really want to go that far, right? But in reality, stress is a big one. And I think a lot of people really think that they handle it better than they really do. And their body says different.
Okay, this is a great opportunity for me to put up the URL for the Ovadia Heart Health quiz. You can find that at ifixhearts.com/quiz, and it's a very easy to take quiz that'll help give you an idea if you're metabolically healthy. And we've seen studies that have shown that numbers close to 85, getting closer to 90% of the population is not metabolically healthy on all 5 markers that we measure. And this test is free and it will help you get a basic benchmark as to your metabolic health and what you can do about it. So I urge you guys to to take a look at the quiz and fill it out and get your free assessment. So when somebody has high cholesterol, high LDL, and the first thing they're told is to get on a statin, first of all, what are some of the reasons why people might not want to be on a statin?
Well, when you know what a statin does, of course, like we were discussing earlier, it does block, cholesterol production, right, in the liver. But also, too, the understanding what it does besides lower the total cholesterol and the LDL cholesterol, it can actually increase the small, dense particles. So it's important to understand, right, the quality of your cholesterol. Do you want more small, dense particles? Those cause atherosclerosis and plaque buildup. So it can be a problem. So you kind of need to know what your baseline is. And then also too, I urge anybody to Google what the side effects of the statin are. People that take them, they're like, my legs ache. I've got brain fog. I just don't, I don't feel right. My joints ache even more. Those should be signs that sometimes, medication's not right for you. Your doctor will want to change it, but then really getting down to the base on the quality of your cholesterol is super important. And then, looking and seeing, but also the side effects. And the other one is type 2 diabetes. If you look at any insert for a statin, insulin resistance is one of the side effects, or it'll say type 2 diabetes.
So before making that decision to go on a statin, are there some specific lifestyle things that you would give as an option for a patient to consider, before they even went down that road? And what things do you find are most effective that people can do? Obviously, you said stress is a big one. What are some of the ways that people could make lifestyle changes that would reverse that inflammation, reverse the insulin resistance, and what kind of success do you see within the practice of patients actually making significant changes in those areas?
So usually when it comes down to nutrition, I think nutrition plays a key role in general, because we've been really brought up on the box and bag era is pretty much it, right? And you go down the middle of the grocery store aisles and it's all garbage and it's not real food. So really getting back to whole foods, right, with an emphasis more on protein. Now, carbohydrates are good in a sense if you're not severely insulin resistant. Now, it's the type of carb, right? Green vegetables are going to be lower in sugar in general. But, finding out the balance that's going to be for you. This is where meeting with somebody so you know exactly what's going to be the right plan for you, because it's not the same for everybody. Some people require a little more, protein, which protein is really the base, and then sprinkling in others. Some people can't do a lot of, fruits and things like that. I have patients that think that honey's okay because it's natural. It's still sugar, but really figuring out what's going to be the best thing for you. And the more insulin resistant you are, the lower the carb that you want to keep it. But protein and fat are really an essential for the body. Fat really helps to keep you full. And then, really keeping everything, because you can't, when you think about insulin resistance, it's about spiking insulin. But when you think about how your body reacts to certain foods, you're not going to get an insulin spike if you're eating protein. So, how your body utilizes the foods that you give it, and you want to focus on the whole foods in general, because then you're giving your body the proper fuel.
How often does it happen where patients come to you who are on a statin and change their course and go off the statins and pursue other ways of improving their health risks?
Most of our patients, when they come to us, they've already done a lot of their homework. They've already started on the journey. They've watched multiple people on, YouTube and Instagram and all of the social media platforms, and they're curious, right? I think that they've gotten to the point, at least the ones that I've met with, that they're like, I know that there's no pill or potion. What can I be doing, right? And really realizing that they have more power over their longevity, the quality of their life, if they take control of it now. And, making sure that they're doing the things that they need to be doing, like putting gas in the gas tank, right? You're not going to put unleaded in your diesel because you're going to ruin it, right? So when you think about the body as a well-oiled machine, you want to feed it what it needs so that it actually can perform for you the way you need it to perform. So
How so what percentage of patients do you think really do need statins, or how often do you think statins are really indicated um, for the situations that you see?
in general, if somebody doesn't want to put the work in, if they want to just go through their normal life, they do the standard American diet, they're very sedentary, they don't want to do anything, there are some actual benefits to statins in the form of anti-inflammatory effects. They can, help in that way. But for people that don't really want to be on medications and want to do the lifestyle changes so that they feel good all over naturally and are really giving themselves a good quality of life, it really is a case by case basis. So that's when, really looking at your labs and figuring out what is going to be the best strategy for you to have good health in general, especially on the inside. And that's where labs really tell us, because you cannot tell by if somebody looks like on the outside on what's going on the inside.
Okay, so an individualized custom experience is what someone could expect when they come to Ovadia Heart Health. Everybody's treated for their individual challenges and situation. Everyone's got different lab numbers and everything like that. From your experience working with thousands, I guess, of patients where you've gone over lab work and stuff, what are some of the most interesting things that you see recur with people? Like what things do people come to you for, where you're seeing this something that mainstream medicine either doesn't catch, doesn't know? Um, where are you able to provide some real benefits for people that might not ever even have their problem or their situation identified if they just went the traditional route?
I think that the number one thing is again, looking at their metabolic health, but also to being able to deprescribe medication. Most people, when they're put on medication, they're told that this is going to be a lifelong medication that they have to take for the rest of their life. Yet people who want to put in the time and the effort and make the lifestyle changes that they want to make, they can come off certain medications when things improve. And I think that is very rewarding. And I think it's exciting for the patients because, again, it saves them money, right? They don't have to pay for the medications anymore, but also too, they've gotten themselves healthy enough that they can come off of the medication and still, as long as they maintain, right? Especially with blood pressure medication. People get put on it and they're on it for the rest of their lives, but really getting to the root cause of why you have high blood pressure in the first place is where you should be really thinking about. Anytime your doctor wants to hand you a prescription for something, you need to ask yourself, how did I get this in the first place? What brought this on? It should be kind of sparking some curiosity. And I think with everything that's out there on YouTube and kind of going down that rabbit hole on, okay, well, how can I fix this? Right? Because, back in the day, we didn't have all these pills and potions and things like that. It was more of what can we do naturally? And I think people have more power than they realize. And just that little bit of curiosity can really, really be important.
I think that's really important. People have more power than they realize. You have people that are in their 50s and 60s and 70s, and really there's no limit to people get it in their head that they are stuck, that they can't fix the problems that they have, and some medical problems are rather serious and are more difficult to solve than others. But when it comes to making intelligent, sustainable lifestyle changes, I've seen some amazing things. I've been working as a health coach within the Ovadia practice since January of this year, and I've been privileged to see patients reverse type 2 diabetes, with A1C in the range of 11 come down to a healthy non-type 2 diet, not even pre-diabetic, like a 5.4 A1C. Now that's life-changing. I mean, that is, and that's not just a one-off type of thing. This is within the power of a person to make these decisions. Do you have any thoughts on like what ingredients go into going from stuck and hopeless to feeling like you can take control? What is the first step someone can take in your experience from people that you've worked with?
First of all, curiosity, right? And then also too, just realizing that you have more power than you think that you do. And age is just a number. So you can literally turn things around at any age. I mean, we have patients within the practice that are in their 80s. So really age is just a number. And if you really want to have good life, good quality of life as you're getting older, you just have to really have the want to, right? I talk about why a lot because in general, when you think about what is your why, I mean, personally for me, I have 4 grandchildren that I would love to, see grow up and have, full lives. And, and my goal is to never have my children have to take care of me. So you have to think what your why is. And I think one of my things I like to say is your why should make you cry. It should be that important to you. And it's not always just for yourself. It's you think about others as well. And sometimes that can be even a better driver than ourselves because we tend to put ourselves on the back burner. But there's no age limit. You can do this at any time. You can start, you can be curious, and you just start with one thing at a time. You don't have to try to change everything. You can start with, I'm going to start making some better choices on what I eat, right? I'm going to eat more whole foods, right? And then, maybe, okay, so now I'm going to just go walk 10 minutes a day, right? So, you just make those subtle changes and start making them more of your natural lifestyle. It doesn't have to be, I'm going to go do this. I'm going to jump in 2 feet. You can just start making gradual changes and those changes will start to add up.
Bob Everson from Lynchburg, Virginia says, great topic and hello. Thank you, Bob, for listening and thanks for sharing that. Lisa, why don't you tell us a little bit about, you explained your why, very powerful. And I definitely have become much more aware of that within my own life, but also as I talk to patients in the practice, as I try to help them work on lifestyle changes that can kind of synergize with the medical interventions that they are getting from you and Dr. Ovadia. It's very helpful when they are able to articulate what they're trying to do this for, because it's like if you can envision, and I mean I've heard it gets me emotional when I hear them talk about they don't want to be a memorandum or like the announcement at the wedding of the people that are not with us today. They want to be at the wedding. They want to be walking their daughter down the aisle. They want to be in attendance and be a part of it. They want to, hike with their grandkids. They want to take their family to the park or to, camping or whatever it is. But tell us a little bit about your own personal journey, because you've had some tremendous success in your own life through adopting a different set of lifestyle choices that have worked extremely well for you. What are some of your personal experiences?
Well, I'm a recovering yo-yo dieter. So I've done every diet under the sun, and until 2019, when after many years of starting a diet every Monday, my whole life, I started the keto diet on a Wednesday, February 28th, 2019. I'll never forget it. But it was more of an eye-opening thing. I started not being hungry. And when you yo-yo diet and you do calorie restriction and you're counting every morsel that goes in your mouth and all you think about is food because you're hungry all the time, it was really a game changer when I was eating, and I was eating whole foods, and I found that I didn't think about food all the time. So that was something that was very different for me. It was easier to lose weight then too. And it was nice to lose weight and not be hungry. Because of course I'd gone to the doctors all the time and they were like, you need to, eat less and exercise more, which, then I would go kill myself at the gym. But again, you can't out exercise a bad diet. But at the time I didn't realize was a bad diet because back in the day when you ate rice cakes with peanut butter on them, right? Because, you're eating styrofoam, but it's supposed to be good for you. And so after that, when it just got me down the journey of doing more and more research, like I tell everybody else to do. And I still learn something new every day from our patients. So I learn all the time. There's new studies being done. There's always new stuff being done. And so it keeps me relevant. It keeps me wanting more. And I just kind of got down that rabbit hole. I ended up getting my certification as a ketogenic nutrition specialist so that I could discuss nutrition with people and feel confident in, what I was talking about. And so it just it kept me there. And being in healthcare for 30 years, I really went into it because I wanted to help people. And as I was at the bedside and working with really sick people in the ICU, and then after I did the keto diet, which I still eat whole foods all the time anyways, it's not like when I did it, here I am. But I was really seeing that we were doing more of a disservice to people. People, younger and younger people were coming into the hospital with heart attacks and sick. And it was just like, I would look at what we were feeding people in the hospitals, and it's nothing but carbohydrates and junk food. And, it's just, now I have more of a power to help people on the preventative side. It's much more rewarding because I think education is key. We can always learn more. And I just really, again, it's about the curiosity. It's trying to figure out how we can prevent a lot of these things for ourselves so that we really do have a good quality of life. That's where it started. That's where it's going to stay. This is my passion, and I love it every day. So
I want to encourage our more than 500 listeners, to anybody that's interested in working with Ovadia Heart Health, go to ifixhearts.com/talk, and you can have a free call with our metabolic health coordinator, and you get the full range of options of working with our team. It could be a consultation with nurse practitioner Lisa Simmons, a one-time consult with Dr. Ovadia, but there's a range of other plans that are available. We have health coaches that work with you along your journey. And let's see, if you want to take the quiz, go to ifixhearts.com/quiz. I have one more question about statins. I know a lot of people are just confused and they feel pressure from their regular doctor. How often does it happen where people come to the Ovadia Heart practice to get a second opinion? Maybe they're still even working with their regular doctor, and is that a conflict? Is that something that is a problem, or is that just something that is typical for people that come to Ovadia Heart Health?
They come to us every single day. That's pretty much one of the main things that we talk about. But again, it's a choice. It's a recommendation. But understanding what the medication does. Anytime you're handed a prescription, you should know exactly what the side effects are. I mean, you should go home and Google it. I mean, we have the internet. You should be looking things up, like what are the side effects of the statins? Because that's going to give you the knowledge on, do I have any side effects from this medication, especially when you're taking a new medication, because you don't know how it's going to affect you, but then you'll already be knowledgeable on what you should be watching for on a new medication. And that's not just specifically with statins, that's any medication at all. You should always know what can the side effects show as, right? Which is important. And then also too, we do answer those questions, but when we start to look at the particle sizing and explaining how things really work in the body and how the statin, what it works on, it's really ultimately up to the patient if they want to continue it for their own sake. They do get a lot of pressure from mainstream medicine. But again, it's the knowledge that you would have in each individual situation on if it's going to be best for them or not.
I can't tell you how many times I've met with a patient after they've met with you or with Dr. Ovadia, and they have a sense of relief. Relief that their questions have been answered, relief that they're on the right path. Many times their health markers have obviously improved just in the the 1 or 2 months that they had been working with the practice, but a lot of times it's just knowing that they're making an intelligent decision based on the labs that they have and everything that you guys are able to see. So that's something I really enjoy about working within this practice is how much clarity is provided to patients so that they know that they're on the right course. Is there anything else that you'd like to add before we sign off?
Well, no, the one thing I want is I want people to realize they're human. We treat everybody as an individual. And, yes, you're patients if you're in our practice, but you're human. And we want everybody to be healthy and we want you to have a long life. And our goal is to get you there.
Oh, awesome. I couldn't agree more. I really enjoy these live streams, Lisa. Thanks for taking the time. And I hope you have a good evening. Thanks, everybody, for listening today. And we will talk to you next week.
Thanks, Chris.
Take care.
Bye.